Hello, I'm Dr. ATIF Kawoosa. I'm presently working as a lecturer at the Government Super Specialty Hospital, Srinagar. Today, we will learn how to recognize emergency situations in epilepsy. Most seizures are less than 2 minutes. So, how some people with epilepsy tend to have severe or life-threatening seizures. For these people, seizures may be prolonged or happen in clusters. In some people, these severe seizures can happen regularly. These situations are considered seizure emergencies. They can lead to brain injury, so it is important to recognize and treat these seizures quickly. Now, fortunately, it is possible to administer out of hospital medications in a way that is likely to stop a severe seizure. Of course, these medications can be prescribed by a neurologist. And now it's important to know if any of these situations pertain to you and to talk to your doctor about these risks. So you ask yourself, have you ever been diagnosed with status epilepticus? Because that's a predisposition to seizure emergencies in future. So see, a status epilepticus is a single seizure that by a pragmatic definition is more than 5 minutes or two or more seizures with a 5 minutes period without a person returning to the normal in between them. Then you ask yourself, have had one seizure, whether ever you have had one seizure after another. I had clusters of seizures over a number of hours or days. So cluster seizures we actually define having more than two or three per day, or by some definitions over a period of hours even. So these clusters has whether a seizure has lasted for more than 5 minutes or longer, had long partial seizures or periods of confusion been there, or have you ever started or stopped medications without medical advice? So you ask yourself, do you have poorly controlled seizures, a known cause of seizures such as infection, stroke, or a brain tumor? Problems then remembering medicines, difficulty taking medicines on a constant schedule, problems affording medicine, seizures during sleep, whether somebody is living alone, low blood levels of medicines. That's, of course, when we do the blood levels. More seizures during medication change and taking many seizure medication. That's again a predisposition. Now, many people with recurrent seizures may have a seizure and awaken fully. Immediate medical attention is not often needed in that person and fully awake, and one who is fully awake after a seizure and he has, and provided he has not suffered any injury, and of course if previously he has not been known to have recurrent seizures. So there are other conditions, however, call for immediate medical attention. These one, as we already described, is a seizure, a status or cluster seizures. Now, if there is again persistent breathing difficulty is there. Now, injuries sustained during a seizure is there. Persistent confusion or unconsciousness is there. Again, if this it is a first ever seizure of life, it has to be taken as an emergency. A significant change from the person's usual seizure pattern in terms of seizures type or seizure length or associated symptoms. So then the evaluation and treatment needed may include, for example, blood tests will be there, and imaging, whether CT or MRI, sometimes spinal taps, electroencephalograms are often required, and medications to stop or prevent seizures are to be given. Now, emergency treatment usually involves IV medications. Treatment is needed to begin soon as continual seizures lasting 20 to 30 minutes. This may result in damage to brain, so it has to start very early. One more thing is that as early as possible it has to be, because otherwise there happens change in brain that makes it resistant to medications in future. So once seizures are controlled, the underlying cause is sought. After that, additional medications depend on the underlying causes and the recommendations from a neurologist, of course. Then home care is appropriate when a person is known to have seizures. If the seizure is brief and if the person recovers uneventfully, usually the patient is being treated by a neurologist and the doctor may need to be notified in that case. However, there are some suggestions that may help prevent injuries associated with seizures. Like, of course, we do all the maneuvers, prevent sharps from touching the patient at that time. We cushion the head, we loosen any tight neck wear if there is some. Then we turn the patient or a person on his or her side after the convulsion ceases. This may help drain any moisture or secretions from person's mouth and prevent choking or aspiration. Do not attempt to hold down or restrain the person. Do not place anything in the person's mouth or try to pry the teeth apart. Observe these items, length of seizures, types of movements, direction of the head or eye turning, amount of time to return to alertness and full consciousness. For many people with recurrent seizures, one key to prevention is taking prescribed medication on a regular basis. Failure to take anti-seizure medications as prescribed is a common cause of recurrent seizures. Certain medical conditions, or interaction with other medication can lead to temporary failure of the anti-seizure medicine, even if taken properly. So that has to be discussed early on. If the cause of the seizure is discovered, so of course it is important to treat the condition and address whatever caused the seizure. So these are the things that we should take care, and we need to know about the emergencies that can happen for an epileptic patient or a seizure patient otherwise. Thank you for patient listening.